Postnatal depression is a condition that actually turns out to be surprisingly common, affecting as many as 1 in 10 mums or more. And the main thing we think of with depression is feeling low and sad, but a lot of other problems go along with it, particularly when you bear in mind that mums are looking after a new baby. Mums often feel that they lack confidence in their ability to look after the baby. They might feel anxious about the baby's health, and this anxiety is out of proportion to what's going on. So if your health visitor, for example, reassures you as a new mum that your baby's fine, with postnatal depression you'll often persist in having worries about the baby's health. You may find that you're tearful at times, even for no apparent reason. Well, of course, with a new baby, often you're woken up to feed in the night, and sleeping is a problem, but even if the baby's asleep, you might be tired and find you can't get off to sleep yourself. Antenatal and postnatal depression are both very similar in the way that mums are feeling. The main difference is that at one time a mother is pregnant and another time she has a new baby for whom she's responsible. And it may be that with postnatal depression a lot of mums' feelings are tied up with the new baby, might be concerned about the baby's health, for example. What's important to bear in mind is that if a mother has antenatal depression that isn't treated, then that will just continue during the time that she has the baby, and afterwards it'll just turn into postnatal depression. Having a baby isn't an automatic cure for depression, and that's why it's so important to tackle antenatal depression when it's spotted. Partners are very important. For mothers with postnatal depression, often they're reluctant to talk about the way they're feeling. They might be embarrassed to talk about it. They may just think that the way they're feeling is all part of being a new mum. So if you recognise that your partner is feeling particularly low and is particularly changed in their mood, then helping them to talk about it is important, and then helping them to seek help either through their midwife, health visitor, or the general practitioner.
Well, recognition of the disorder is the most important thing, really. Sometimes therapy can help, but a lot of women need antidepressant therapy. They need to take medication.
Well, the two main avenues of treatment are either with counselling or psychotherapy, or with antidepressant medication. People have often heard of some antidepressants like fluoxetine or Prozac, and they're the sort of drugs that can be helpful for depression in new mums.
But there is a risk of the same problem happening in a future pregnancy. So if a woman's had one episode of postnatal depression after one baby, she's at increased risk of having it in the next pregnancy, and that needs to be looked out for.
Well, postnatal depression affects not only the mum, and without treatment that depression can go on for as long as a year, but it's going to affect those people around her. So partners can be affected by the depression, and it can have a severe effect on the quality of the relationship. And of particular importance, it can have an effect on the developing child. And research has been shown that if mothers have postnatal depression which isn't treated, children can have problems in their own emotional development and their social development. And even now it's recognised that children of mothers who've had long-lasting postnatal depression have school problems, so it's problems that persist well into childhood.